A local study conducted by 5 major Taiwanese medical centers found 4 major risk factors of sudden death related to heart disease.
In Taiwan, 20% of cases of sudden death from heart disease are related to arrhythmia. FTV reporter Stephany Yang got some tips from experts on how to self-assess and prevent the disease.
Atrial fibrillation is the most common form of sustained arrhythmia. According to statistics from the Ministry of Health and Welfare, there are 300,000 to 400,000 people in Taiwan who suffer from atrial fibrillation. A local study conducted by 5 major Taiwanese medical centers found 4 major risk factors of sudden death, and 20% of sudden death cases in Taiwan are related to arrhythmia.
According to the results of our study, we found that about 20% of patients who died of sudden death outside the hospital in Taiwan were afflicted with arrhythmia. They died from heart failure or atrial fibrillation. An analysis showed that the patients were found to have several risk factors, namely SACAF. The S stands for sex. Male patients are prone to such sudden death. A stands for age. People less than 65 years old are more susceptible to sudden death. C stands for cardiovascular disease, and AF is for atrial fibrillation, which is associated with an increased risk of sudden death.
Common symptoms of atrial fibrillation include palpitations, weakness, dizziness, difficulty breathing, chest tightness, chest pain, and sweating. However, doctors say up to 1/3 of patients have imperceptible symptoms, a condition known as silent AF. If atrial fibrillation is not diagnosed, it may increase the risk of stroke and sudden death. Doctors share some tips to prevent the disease.
You can exercise regularly, eat a healthy diet, don't overwork yourself, and keep your heart and blood vessels healthy. How can you detect atrial fibrillation? We tell patients and their families that the detection is quite simple. Just learn to take a pulse. If the pulse is suddenly strong, slow, or fast, it may be atrial fibrillation. The most important thing is regular checkups. The Labor Council orders workers to have regular health checkups. But if you work for yourself or are a freelancer, you may not notice problems that occur. And they could become more serious if you don't get regular health checkups on your own.
Doctors say the incidence rate of atrial fibrillation increases with age. It is imperative that those who suspect they have the condition to seek medical attention as soon as possible to receive early detection and treatment. FTV reporter Stephany Yang and Shi Bohan in Taipei.